20 foods to be avoided by kidney patient. Dark-colored soda. Dark-colored sodas should be avoided on a renal diet, as they contain phosphorus in its additive form, which is highly absorbable by the human body. Canned foods are often high in sodium. Avoiding, limiting, or buying low-sodium varieties is likely best to reduce your overall sodium consumption. Whole wheat bread. White bread is typically recommended over whole wheat bread on a renal diet due to its lower phosphorus and potassium levels. All bread contains sodium, so it's best to compare food labels and choose a lower sodium variety. Brown rice. Brown rice has a high content of phosphorus and potassium and will likely need to be portion controlled or limited on a renal diet. White rice, bulgur, buckwheat, and couscous are all good alternatives. Bananas. Bananas are a rich source of potassium and may need to be limited on a renal diet. Pineapple is a kidney-friendly fruit, as it contains much less potassium than certain other tropical fruits. Dairy. Dairy products contain high amounts of phosphorus, potassium, and protein and should be limited on a renal diet. Despite milk's high calcium content, its phosphorus content may weaken bones in those with kidney disease. Oranges and orange juice. Oranges and orange juice are high in potassium and should be limited on a renal diet. Try grapes, apples, cranberries, or their juices instead. Avoid pickles, which contains lot of salts and potassium. Potatoes and sweet potatoes. Potatoes and sweet potatoes are high potassium vegetables. Boiling or double cooking potatoes can decrease their potassium content by about 50%. Tomatoes are another high potassium fruit that should likely be limited on a renal diet. Packaged, instant, and pre-made meals. Packaged, instant, and pre-made meals are highly processed items that can contain very large amounts of sodium and lack nutrients. It's best to limit these foods on a renal diet. Spinach and beet greens. Leafy green vegetables like spinach and beet greens are full of potassium, especially when served cooked. Although their serving sizes become smaller when cooked, their potassium contents remain the same. Dates, raisins, and prunes. Nutrients are concentrated when fruits are dried. Therefore, the potassium content of dried fruit, including dates, prunes, and raisins, is extremely high and should be avoided on a renal diet. Pretzels, chips, and crackers. Pretzels, chips, and crackers are easily consumed in large portions and tend to contain high amounts of salt. Additionally, chips made from potatoes provide a considerable amount of potassium. Kidney patient should avoid alcohol. Trans fat is injurious to kidney patient. Herbal supplement may contain toxin damaging kidney. Avoid processed chicken and meat. Avoid cold drinks which contains phosphorus and salt.